Hello, everyone, and welcome to the Let's Talk series. Here at Mount SAC, we are striving to bring you useful information to help support you with beginning or continuing the conversation about mental health. My name is Desiree Hernandez. I'm a licensed clinical social worker working with a team of licensed mental health providers at Mount San Antonio College Student Health Center. Today, we'll be discussing depression. Please be aware that there will be topics discussed that may trigger or create emotional reactions. We have included hotline numbers during the presentation to utilize in the event you need further support. Please know that moving forward, this is not a substitute for seeking mental health services or seeking medical treatment. It is important for you to speak with a professional to acquire appropriate diagnosis. There are many personal factors that influence a diagnosis, and this presentation cannot capture those. In this presentation, we will also discuss quite a few resources. We do not endorse nor receive any compensation for mention of these resources. We only provide them for you to further explore as we have found them useful in our own practices with our clients. So let's get started. We first need to understand what depression is. According to the DSM-5, a manual mental health professionals use to diagnose, a depressive episode occurs for 2 consecutive weeks, for more days than not, which could be experienced by a combination of the following: fatigue, lack of energy, feeling weighed down, change in sleep patterns, change in eating patterns, difficulty concentrating or making decisions, feeling down or sad, disconnected, loss of interest in enjoyable activities, low self-esteem, worthlessness, uselessness, thoughts about death, dying, not wanting to live. So we refer to these as symptoms of depression, and we will be taking a look at these more closely in a bit. Here is the list of some of the causes of depression: genetics, brain changes, medical problems, life circumstance, trauma, substance misuse, that includes drugs, alcohol, prescription medications, all can cause depression. So it's important to talk to a professional about any of these that you may be concerned with. Depression is experienced in different intensities: mild, moderate, severe. We are going to watch a short clip of people describing what it was like for them to recognize that they were experiencing depressive symptoms.
I was 18 going on 19 years of age. I just left home to go down to Canberra to go to university. And I was down there probably for about 6 months. And things weren't right. I wasn't quite sure what was wrong. I just felt sick all the time. I felt really angry. I just struggled to get out of bed. I just didn't feel fee.
I was working very long hours. I was quite isolated. I was living about an hour and a half away from my family, and things just became quite overwhelming, and to the point where I wasn't really able to cope.
I was really enjoying going around to these obscure whistle-stop libraries, feeling really good, and until one particular evening when I guess the depression or the anxiety simultaneously snuck up on me, and it was like being hit with a feather. I was speaking in a large library. All of a sudden, I lost my history. I lost my way. I lost my voice.
My depression came on through circumstantial things that happened in my life. My dad committed suicide. I broke up in a long-term relationship. I was accused of stealing money, and I was chugging along okay until I did a knee injury. And up until that point, exercise had been, I suppose, my way of coping. And when that was taken away from me, I floundered very badly. I just wasn't able to sleep. I wasn't able to eat. I didn't want to do things that I normally did. I was crying a lot, but still saying there's nothing wrong with me.
I didn't notice until people pointed out to me that I was having socialising problems. I was getting angry. I didn't realise that either. It was just, I just thought that was just life.
After a while, I realised it wasn't normal to wake up in the morning and have these sort of feelings of helplessness and this blue sort of cloud that would envelop me, and then realise that I should start speaking to someone, and only then did I start speaking to family and friends and started to realise that, oh, hang on a minute, this is not normal behaviour, and there are other people out there that are in the same situation.
By the time I sought help, I was hardly able to function effectively. I was scared to go outside, scared to go to work. I didn't have the confidence to get a job, to study. I couldn't keep my thoughts together enough to read or to write.
And they said, you've got clinical depression and serious anxiety. And they gave me a referral to a city clinic.
Then I was hospitalised, and that and my mum just saying, no, we're not going to, you can't push me away, you can't keep pushing me away. We're going to talk with this, we're going to deal with it. That started my road to recovery. So I then had to admit to myself that yes, I did have depression. And then I started, in conjunction with medication, I also had some counselling as well, and that started me on my road to recovery.
And it wasn't until my depressive symptoms reduced and I was able to engage in therapy that I actually then accepted the diagnosis and acknowledged that I did have an illness.
They diagnosed me with having depression, and I was in counselling for a long time and on medication. And that's how it all started.
As you can see, people experience depression at different moments of their lives, but all of them describe recognizing a shift in their ability to function. Let's take a closer look of how people have described what depression feels like. Discussing our feelings can be so challenging to put into words. I thought it would be useful to take a look at some examples of how people have described what depression feels like for them. I couldn't feel anything for my husband or for my kids. My emotions were completely dead. I knew I loved them, but I just couldn't feel it. This bad feeling that is never going to end. Feeling bad about myself. Feeling guilty for not being able to do more. Feeling completely out of place. Feeling lonely and cut off from the world. Getting out of bed and getting ready for the day is unbearable. I let everyone down. Loving painting, but then one day just feeling like I couldn't do it anymore. Not enjoying the things that I used to. Texting my friends back is so overwhelming. Keeping up friendships is exhausting. Again, I can't stress enough how different people can describe feeling depressed. But I want to point out it also shows that many people struggle with depressive symptoms daily, and you are not alone in that struggle. Let's take some time to talk about what depression might look like. Sometimes behaviors are much easier to recognize and identify before we are attuned to our feelings. Here are some examples of what people have said about how they recognize they were depressed. Not being able to concentrate. I couldn't even read a book to my child at bedtime. I couldn't sleep anymore. My mind would just zoom in on all the negative things in my life. Avoiding my friends and loved ones because you think they don't like you. Eating because it is the only thing that brings me comfort, but then feeling guilty for everything I just ate. Walking around like a zombie. Snapping at my mom for no reason. I know she didn't say anything wrong, but I feel angry all the time. Skipping meals because I just don't feel hungry. Sleeping all day because facing the day seems impossible. Not taking a shower for days or staying in the same clothes because it requires too much energy to get up. Notice here behaviors vary. Some people can sleep too much or not at all. Some people can overeat or skip meals. Depression impacts us differently, and it is so important not to measure your depression by comparing it to others, but recognize how it is impacting you and how you may benefit from taking care of yourself. Now that you know a little more about recognizing depressive symptoms, you may be asking yourself what you might be able to do if you think you are experiencing depression. There has been significant research of what the best practice is for treatment of the different levels of depression. One of the options is psychotherapy. And this is where you meet with a mental health therapist and you work together to identify goals to help improve your quality of life. Another option is medication. There are times where medication is essential for combating depression, and there are times where medication is not necessary. Each person is unique, and therefore it's important to see a psychiatrist or your general practitioner to be evaluated to see if you're a candidate for medication. And lastly, there's the combination of medication and psychotherapy services. This has been proven that both medication and psychotherapy are warranted for the best outcome when medication is being used. So these are just some of the traditional treatment options for depression. Now I'm going to shift a little bit, and today I want to talk about 2 strategies that you would be using while working with a therapist. The first category of coping is behavioral strategies. Get moving. Behavioral strategies are focusing on changing some of the behaviors that contribute to maintaining the depressed state. You often hear us talk about exercise and the benefits. Now, I want to stress that we are not talking about running a marathon or building a 6-pack. We want to stress the importance of moving. This can be as simple as going for a walk, stretching, dancing to a song. Our bodies and brains need movement to produce brain chemicals that will naturally fight against depression. And get moving means engaging in tasks. When we complete tasks, our brains and emotions respond positively. Sometimes depression can be so severe that the thought of getting out of bed is a task in itself. In these instances, we suggest setting specific time goals, like staying out of bed for just 5 minutes, and then increasing that as you improve through your day. This is a resource of suggestions of fun activities you can engage in. It is free to download from the Center for Clinical Interventions. Let's take a look and see the variety of tasks that can get you moving. You can see lighting scented candles, oils or incense, bird watching, laughing, gardening, doing arts and crafts, doing a favor for someone, massaging hand cream into your hands. So I just want you to see that no task is too small and be proud of any task that you can complete. Another major coping strategy is to focus on your thoughts. We often use thought records to help you understand your own thinking and behavior patterns. You begin to learn healthier and more effective coping the more you keep track of your unhealthy thoughts. Therapists will often use thought record worksheets to guide you in practicing evaluating your thoughts in an effective way. Writing it down immediately or soon after an experience helps to accurately identify thought patterns that contribute to depressed feelings. Here are some simple thought records, recording sheets that you can utilize. See, it has situations, thoughts, emotions, behaviors, alternative thoughts. And here's another one that's a little bit more guiding with prompts at the bottom of the columns. Still evaluating the same things, the situation, your mood or reactions, your physical reactions, thoughts associated to the situation, and maybe some alternative thoughts or behaviors that could have happened. And then what you did or what you could do differently in the next times, or what sort of techniques you could use the next time a situation like that were to occur again. So thought records can look very simple or they can be more involved. It really is just what you are comfortable with and what you need. Now let's talk suicide. Today, my goal is to help you understand that as professionals, we are ready to discuss some of the scariest and darkest times that you may be experiencing, and suicidal thoughts is one of them. Sometimes extreme depression causes suicidal feelings. It is a symptom of depression. Terry Wise, who is an author and survivor of a suicide attempt, she wrote Waking Up, Climbing Through the Darkness, talks about suicide. Her quote, "Suicide doesn't stand alone. It doesn't just happen as the result of nothing out of nowhere. It is the result of something. Suicide had become almost like a coping mechanism, and I learned through therapy that death was not the only way to end my pain. There were other ways to end my pain besides death. And one of them was developing coping skills and learning how to manage my feelings in a different way," which I did. So here is a graphic that identifies all of the warning signs of suicide, or some of the warnings of suicide. And so let's take a closer look. You want to be mindful of someone that is talking about wanting to die, or has great guilt or shame, or being a burden to others. They might talk about feeling empty or hopeless or trapped or having no reason to live. They might seem extremely sad, more anxious, agitated, or full of rage. Or they might be experiencing unbearable emotional or physical pain. Some behaviors that might change, they might start making a plan or researching ways to die. Withdrawing from friends, saying goodbye, giving away important items, or making a will. They might start taking dangerous risks, such as driving extremely fast, or displaying extreme mood swings, eating or sleeping more or less, using drugs or alcohol more often. So if these warning signs apply to you or someone you know, get help as soon as possible, particularly if the behavior is new or has increased recently. Below are some numbers: National Suicide Prevention Hotline and the Crisis Text Line. So here are some emergency services, some of which I just mentioned. The first one here you see is the Need Help, the Text Courage text line. This is a crisis text line. It provides free 24/7 mental health support via text if you're not comfortable with calling. And then the next one you see here is the National Suicide Prevention Lifeline. And there's the number, the 1-800 number there. It is free to call. It is confidential. It's available 24/7, and you get to speak with a trained professional. And then lastly is the 911. In the event of a life-threatening emergency, you want to call 911 immediately so you can get immediate care. Here are just a quick list of some more self-help resources for coping. There's plenty of information online through NAMI, which is the National Alliance of Mental Illness, and the Center for Clinical Interventions, activeminds.org. There's this Live Your Life Well. There's also this really cool audiobook. It's free by Dr. Michael Breus. I might be saying his name wrong. The Power of When. And you'll be able to look into that on your own if you just Google that in the YouTube search bar. And he provides a lot of information about sleep, routines, and the importance of those aspects for your life. So that way you can decrease the experience of any mental health conditions. Suicideispreventable.org, suicide prevention lifeline.org. And I put Pinterest on here because you can actually go on Pinterest and get some worksheets for free if you just like type in self-help resources for depression, and then a bunch of worksheets might pop up for you. So check those out for more self-help resources. So another resource for you is through Mount SAC. This is a professional resource through Student Health Services. Mount SAC Student Health Services is located in 9E and 67B, but our COVID-19 response is providing telehealth therapy, and it's by phone or by video conference using the secure platform of Zoom. Now, I want to reiterate and emphasize that it is confidential platform, so there's extra security measures being taken to make sure that your Zoom meeting is secure. Mental health services are short-term through Mount SAC. It is where you work with a licensed clinician to develop attainable goals to improve your daily functioning. If long-term care is needed, referrals will be issued. You can call the number here, 909-274-4400 to make an appointment. The phone lines are open Monday through Friday, 8 a.m. to 4:30. So please take advantage of this resource that Mount SAC offers you. So there are other campus resources free to your access. Some of these are at the health center as well. You can find self-help videos that are developed by the professional team there. There's monthly virtual events lined up for the fall, so take a look at the website at the health center. As well as through the health center, you can find mindfulness and meditation. There you can sign up for a 30-minute session that can help you to create a space to connect, learn, and develop self-care practice that can be done at home. The sessions are free and are held via Zoom as well. And you can actually also find a couple of podcasts there. So mindfulness and meditation is also a very significant coping skill to help decrease depressive symptoms. And another area that you could look into through Mount SAC is the Wellness Center, and they have a Live Well Mount SAC online platform, and you can check out their different tabs on mind and body and nutrition and cooking. So go click around there too for some free resources on exercise, eating. They even have some parenting resources there. So Don't forget about your campus resources. And also remember, it's not free, but you do have the unit for GE credits for PE. So, sign up for a class as well to get your body moving. I just want you to remember that no feeling is final. Our feelings are fluid and ever-changing, so you can overcome depression, learn to live a happier and healthier life, and succeed. It starts with self-care. It takes courage to recognize your struggles and begin a conversation with someone about them. If any time during this presentation you wondered if you should speak to a professional, turn that voice up and reach out to a professional, whether it's through Mount SAC, a hotline, or your primary doctor. Someone is always ready to listen. I just want you to have a great day and keep checking back for new information and events. Thanks for joining us.